All right. Andy, you got the paper. I gave it back to you.
Yes.
All right. Today we're going to be talking to Mr. Andy Barnett. He's been a patient of mine for 2 months, correct?
That's right.
And tell me, when you first came to see me, talk to me about that first visit that we had. What was it like, and kind of how did you find me and all that?
We had been through 8 doctors trying to find somebody that first started out. My chiropractor said, you know, you're not getting any better. I've been working on you for 20 years. The last 3 years I've been to another surgeon, and he just kept giving me epidurals and said come back, and I did rehab, did all that. But my chiropractor is a good friend of mine, and he said, before you go and have surgery, you know, I want you to go to a neurosurgeon, a neurologist, and have all this checked out, because he said, I'm just not sure surgery is going to help you. He said, I think it's more of a muscle issue, something else going on. I had all these problems with my stomach. I was in so much pain. You know,
You didn't have any bowel movements, you told me, for a long time.
I was going 5 and 6 days without going to the restroom, and the bowel movements, and it was just, and when I did, it wasn't good ones. And
right.
I was starving to death, but I couldn't eat. I was just so full. And this area down here, everybody I went to, I had a colonoscopy, I had everything, and everybody just said, well, I don't know what's wrong, but there's nothing wrong with you.
Right, because they couldn't find anything on the test.
I couldn't wear a belt. I couldn't touch my stomach area, because if I did, sweat would pop up on my lip. It hurt so bad. I couldn't sit up. I couldn't stand up. I just, I laid on the floor for 6 months.
And that's because the back pain was so bad, correct?
I just had spasms all the time. I could walk around a little bit and the spasms wouldn't bother me as bad. But standing or sitting, I'd have that spasm. The only thing that would give me relief would be to lay down.
Well, I remember the first day you came to see me, I think your wife was here with us that day, and just sitting down and talked to you. I think we talked for about an hour and a half, correct?
That's right.
And I told you, after looking at your MRIs, looking at your pictures, I told you that my belief was that you had a low testosterone level, bad vitamin D level, horrible DHEA, that you had really bad degenerative disc disease, and I thought the problem was your diet and that you had a leaky gut. Wasn't that correct?
That's right.
And I know that day you looked at me like I was out of my mind. And
yeah, I thought you were, because, you know, we're hardwired to, you know, either operate on me or give me some medicine and make me better. You know, I just, it hurt for so long, and I'd try to put it off for so long. I just wanted relief and wanted it now.
I know. I remember that day you kind of wanted me to operate on you as fast as possible.
I wanted relief, and
right.
I'd completely lost hope. You know, that's what hurt more than anything, was that I was laying on the floor for 6 months and completely, you know, sitting there, well, what if operating it don't work? I'd get to the point that I didn't care.
Right.
You know, I'll be honest with you, it was the first time in my life that I prayed that the good Lord would take me. You know, I was just so tired of hurting.
Right. And chronic pain will do that to you. Just absolutely wears you out. I mean, I seeing you that first day and thinking back on it as we're talking today, I knew what you were feeling that time, and I knew what was wrong with you. I just had to get you to the point to trust me to try to fix you without putting a 10-inch incision on your back with a bunch of screws. And I remember when you left that day, and I told you to do all those things. I told you the first thing we're going to do is we're going to change your diet and put you on a Paleolithic diet. And I know I gave you, you know, Rob's book and the other couple books that I mentioned. And I told you that we were going to get you tested for a leaky gut. And I sent you down to have a whole bunch of functional tests done. Tell us kind of what happened. Because I know you came back to see me a week later and you told me that you were starting to have bowel movements and everything started getting regular. And you were kind of shocked. Your pain was even getting better. But tell us through your eyes what it was like the last couple of months.
Yeah. Well, after 4 days, I mean, you had me. I'll be honest with you, I left here, I was shaking my head. I was like, oh no, this is the 9th doctor I've been to. What am I going to do? But, you know, the doctors before said, you know, your cholesterol's high, you've got all this inflammation in your body, you need to get healthy, you need to get on a good diet. And I was eating vegetables, I was eating oatmeal, I was eating stuff that I've been taught my whole life was a good diet. And it was killing me. Like you said, it was like pouring gasoline on a fire. And so I started the diet 4 days later, I had my first bowel movement. Just still can't believe I'm still talking about that, but
well, when you don't have them that often, it's something that you need to talk about.
And that was 2 months ago, and I've had one every day since. The Paleolithic diet, my stomach, I have no stomach pain at all anymore. Everything is a long ways from normal still with my muscles and my back and my stamina, but I'm so much better. And just like I told you before, I finally have hope again.
Well,
I think I'm going to get better.
We're not talking surgery anymore, are we?
That's right.
We just talked earlier before we did this video that I told you, me as a surgeon, I make my money cutting on people. And when you came to see me, did I ever talk to you about surgery?
No, you told me, I can fix you without surgery, and I was at the point I was hurting so bad, I was like, that was the wrong answer, and I can't believe that, but that was the wrong answer. I wanted you to say, yeah, I'm going to operate on you, and in 3 months you're going to be back to normal, and it wasn't, and I was like, oh, gosh, but like I said, after 4 days you had me. I've listened. I've done exactly what you said. I've done everything you said, and I've probably done a little more.
No, you have. I mean, you went down and got all the extra testing that I wanted you to get. In fact, today, your visit, you brought me all the testing back, and I told you after reviewing it before we came in, I think the news for you is even better. You only have like 6 or 7 different things that are off that we can fix with supplementation. You're already starting on those things. I think that's going to make a huge difference. You also told me that you started using the cold thermogenesis program, and now we're going to start stepping it up to try to improve what you just said, your stamina and things like that.
That was a shock to my system, but when you come from every single doctor you go to giving you a different kind of medication. I was on statins, I was on gabapentin, I was on
I took you off all
steroids. I'm off everything now except for one medication, and I think I was on 6 when I came here.
Right.
So I mean, I've come a long ways. It's just that
we're not done with you yet.
In 2 months, it's unbelievable.
Yeah, I mean, we're not done with you yet. I told you the first visit you were here, and I reiterate that today. That a year from the first time I see you, you're going to be a new man, and we're going to do it without surgery. We're going to rebuild you the way you're designed to work. You just got to stick with it. And I told you, I think the next step, as long as you stay on the diet, we keep using the cold thermogenic program, and we step it up, because we are going to step it up. We're just going to keep following you and retesting you and see how it goes from there. But my goal, I'll consider it a failure if you and I have to meet on an operating room table, because I think I can fix you. I think I can fix you without it. And I told you that from the beginning, and I know you're a doubting Thomas, but I can see in 2 months now you're not.
I saw the burning bush.
That's funny.
Yeah.
That's good. I like that, Andy. That was really good.